This is Chapter 39, Promoting Musculoskeletal Function. These are the theory objectives for this section of the chapter. And these are the clinical objectives for this section of the chapter. So there are a multitude of things that can affect a person's activity level, including his or her personal preferences, their values, their beliefs, availability of resources, their health status. Some variables that influence mobility can be controlled or modified, and while others can't. So, for example, a person can make a choice of whether or not he wants to lead a sedentary lifestyle or have an active lifestyle based on his or her physical limitations. A person can choose to take the stairs or take the elevator, or walk or drive a car. But he can't make a decision to decide whether or not to have a cognitive deficit that impairs their immobility. Um, there's a lot of different physical things that can happen to a person to cause them to be immobile. Perhaps they may have had a stroke or some type of trauma, some type of neuromuscular disorder, or any chronic debilitating illnesses can can cause a person to be immobile as well. Immobility can affect a lot of different parts of the body and cause various issues. For example, a person that's immobile is at risk for pressure injuries. So we need to take precautions for that. A person that's immobile is at risk for respiratory issues such as pneumonia, bone loss, loss of function, or and these things cause the person to be weakened, which increases their risk for falls. There's cardiovascular issues that can occur, such as venous stasis. And so remember, stasis just means something's not moving. So if we're talking about venous, we're talking about the venous system. So blood's not moving, which increases the risk for blood clots to develop. There's GI issues that can occur. There's urinary issues. If you have urinary stasis, remember I said stasis is something's not moving. So if we're talking about urinary stasis, the urine is not moving, which increases their risk for urinary tract infections. So the brain, a person that's immobile having decreased mental activity or decreased sensory input, decreased socialization, increases your risk for boredom and depression, which can also lead to confusion. So there's a lot of different things that can occur from a person being immobile. So let's start with the cardiovascular system. So a person that's immobile, how can their cardiovascular system be impacted? Like I said, you have venous stasis, meaning the blood in the veins or blood vessels is not moving, and then you have increased cardiac workload. So the heart is going to have to work harder. Alterations in your blood pressures, and so like I said, if you have venous stasis, that blood is not moving, then that increases your risk for blood clots. You can have thrombus formation, thrombophlebitis, or pulmonary embolus. So when you have a thrombus is a blood clot that forms in the veins in the extremities. So maybe you have a blood clot that forms in the leg. If that blood clot breaks off and travels somewhere, it becomes an embolus. So if it travels to the brain and the embolus travels to the brain, it can cause a stroke. If it travels to the heart, it can cause a heart attack. If it travels to the lung, it can cause a pulmonary embolus. And so, these are some issues that can occur cardiovascular wise when we're talking about immobilized patients. So some nursing interventions that you can do to try to prevent these cardiac problems or cardiovascular problems. If they're in the bed but able to move themselves, they can do active range of motion. If they can't move at all, then you can do passive range of motion with them. The compression devices or the foot pumps to try to promote venous return back to the heart. Maybe they need some anticoagulants or something like that. If at all possible, if it's not contraindicated, get them up ambulating, if at all possible, and have them, walking as much as possible. Okay, so some respiratory issues that can occur when a patient is immobile. Like I said, if you have stasis, so stasis of the respiratory secretions, so the respiratory secretions aren't moving, that increases your risk for hypostatic pneumonia. And so that's usually hypostatic pneumonia usually results from a collection of fluid um, in the lungs. And so the fluid's just sitting there collecting and can cause hypostatic pneumonia. Bacterial pneumonia, anytime you have that fluid just sitting there not moving, bacteria can increase in the area. And so then you can develop bacterial pneumonia. Atelectasis, that's a complete or partial collapse of the lung or part of the lung. And then decreased gas exchange. Gas exchange takes place in the lungs, so the exchange of O2 and CO2 takes place in the lungs. And so um, that can, decrease as well, which also increases your risk for pneumonia and some other respiratory issues. So some nursing interventions you can do to prevent respiratory issues in an immobile patient. Encouraging that patient to cough and deep breathe every 1 to 2 hours. Encouraging them to turn or helping them turn on a regular basis so that um, we get those secretions moving. Having them use that incentive spirometer at least 10 times every hour. Encourage ambulation if at all possible. Get them up, ambulating, and moving around. Um, you want to monitor their lab values as well for any abnormalities that might signal infection or something like that. And then if they have any respiratory treatments, obviously we're going to administer those as well. All right, so gastrointestinal issues that can occur or that can occur in a patient that's immobile. Um, Anorexia, meaning no appetite, not wanting to eat. Um, and decreased peristalsis, so things stop moving um, in the gastrointestinal tract. And so, which can, if you have decreased peristalsis, that increases your risk for constipation. If you're constipated, you have abdominal distension. If you're not eating, you're going to have weight loss and protein deficiencies as a result. So some nursing interventions that you can do to prevent GI issues in a patient that might be immobile. Obviously, you're going to do your GI assessment every shift, but monitoring daily weights to make sure they're not losing weight. Um, Encouraging nutrition, administering stool softeners or laxatives if they need it, if they become constipated. Assess their food intake to make sure they're getting the proper nutrients that they need, making sure they're getting fluids and fiber because, again, remember increased fluids and fiber to help with that constipation. And then assessing their bowel sounds. Are they passing gas or are they having stools as well? You want to monitor all those things. Okay, so musculoskeletal issues that can occur in a patient that's immobile. They can have decreased muscle mass and shortening of the muscles, loss of calcium from the bone, decreased bone weight. And so all these things increase their risk for weakness, joint contractures, osteoporosis, bone pain. And so with these patients, which if they have increased weakness and all these other issues, increases their risk for falls as well. So we got to, monitor, um, put those things in place for fall risk. So, nursing interventions you can do to prevent musculoskeletal issues in a patient that might be immobile. Again, active or passive range of motion depending on their ability to move. Making sure you're doing your musculoskeletal assessments. Physical therapy. Maybe they need some calcium supplements as well. um, Administer, well, you're going to monitor their pain level and administer any pain medications um, as needed that they might have ordered or whatever. And then try some weight bearing exercises if they're able to, if nothing, if it's not contraindicated in any way. Okay, urinary issues that can occur in a patient that's immobile. So, like I said, we can have urinary stasis, meaning the urine is not moving. And so, if the urine is not moving, that allows bacteria to build up in the urinary tract, which increases your risk for urinary tract infections and renal stones. And so that's where you get the why you'd have the dysuria or the frequency in urination or whatnot. With the urinary tract infections and things like that. Um, so some things you can do to prevent urinary issues in a person that might be immobile. Obviously, we're going to monitor their intake and output, monitor for pain on urination or dysuria, and any changes in the urine that you might notice. Foul smelling urine. Um, is there any sediment in the urine? Is it urine bloody or pus? Or, monitor for all those signs of urinary tract infections. Increase their fluid intakes. Encourage the patient to change positions so that the urine isn't just sitting there and not moving. Um, Monitor their vital signs as well. So, issues with the skin in an immobile patient. So, when you have decreased circulation from the pressure of just laying in that one spot, you have decreased blood flow to that area. And so, decreased, what did we say? The blood carries nutrients and oxygen to various areas of the body. And so, if we have decreased blood flow to that area, then we can get necrosis of the tissue, and then skin breakdown and pressure ulcers can develop in that patient. So nursing interventions you can do to prevent skin issues in a mobile patient. Obviously, we're going to do our skin assessments um, every shift, and make sure you keep your bed linens dry, smooth, and clean. You want to turn your patient every 2 hours. You want to use pressure relieving devices or cushions to pad the areas. Obviously, we're going to encourage fluid intake. So, to maintain hydration, have proper nutrition as well for our patients to help. Um, Mild bathing products. You don't want anything harsh or things with alcohol or, perfumes and things like that. You want mild bathing products. Um, and if they are incontinent, you want to making sure you're cleaning the urine or stool or whatever off on a regular basis so that it's not just sitting there, increasing their risk for skin breakdown. Encourage them to get out of bed as much as they can, um, so they're not just laying in the bed, putting pressure on those areas. If you notice any redness or possible pressure areas getting ready to develop, then you want to make sure you notify the physician so some things can be put in place to prevent that area from breaking down. Okay, issues with the brain in the immobile patient. So, when you have that decreased mental activity, decreased sensory input, no socialization, that puts you at risk for boredom and anxiety, It increases your risk for depression and loneliness and confusion. All those things can occur in an immobile patient that's not able to get up and socialize and things like that. So, some nursing interventions you can do to prevent psychological issues in your immobile patient. You want to do your orientation assessment every shift. So, making sure they're oriented and not confused. Encourage their family and friends to visit so they're not feeling lonely. Place the client in a chair by the nurse's station, if at all possible, so they're not just sitting in their room by themselves all day, every day. Um, are there any reading materials you can do? Can we go, if they are able to get up in a chair, can you take them to activities with other clients in the area or whatnot? Just sitting and talking with them, if time permits. And like I said, encouraging different activities. And if they are, getting, too depressed, then maybe they need some antidepressants or whatnot to combat that depression. So for various reasons, you might need to um, immobilize a particular body part um, to prevent further injury from occurring. So, for example, you might use a splint. A splint can be used to protect an injured part by immobilizing that particular body part. You might have traction or pulling, and so that's going to force, it's going to force uh, to maintain the body part in alignment because you want to keep the body part in alignment. You might have a cast. A cast is going to immobilize an extremity after a fracture or some type of orthopedic surgery or something like that. When you have a cast, you need to assess regularly to ensure that the limb is not swelling. And so, an indication that it is swelling is that the area um, that's distal is a dusky color and it's cold. So you want to make sure you're assessing for that and make sure you educate your patient to not stick anything down in the cast um, for scratching or anything like that because they can cause injury to the skin or whatever. Don't change the position of the injured part because uh, you can cause further nerve damage if they, in traction or something like that. Cover any open wounds with a sterile or clean material. Okay, question one. Sharon's patient has had restricted movement for a long time. One major complication Sharon's patient might develop is, and your answer here is number one, hypostatic pneumonia. And so that's a major complication due to stasis of the secretions um, from being inactive, so stasis of the secretions in the lungs. Question two, Sharon's patient has a continuous passive motion machine. This machine can be used to, the answer is for exercise the joint after a joint replacement surgery. So a continuous passive motion machine is used, that's what it's used for, to exercise the joint after he's had some type of joint replacement machine. Um, After any surgery, a patient should be able to turn or be turned every 2 hours, cough and deep breathe. And a cast is used to provide immobilization for a fractured area. Sharon is working on an orthopedic floor. How often should she inspect casts for cracks, crumbling, pressure problems, and infections? The answer here is going to be every shift. So during your assessment, which is every shift, you should inspect the cast for these things, as well as signs for infection. Okay, these are the theory objectives for the next section of this chapter. These are the clinical objectives for this next section of the chapter. Okay, so when you have an immobilized patient, uh, other than your head to toe assessment, you're going to do a detailed assessment on the immobilized body part. So you want to make sure you assess skin, you want to assess movement, sensation. Do they still have sensation? What are their pulses like? What's their capillary refill like? Do they have pain in that area? So you want to do a focused assessment on that immobilized um, body part. And all those things we discussed before: circulatory, respiratory, um, their activities of daily living. Can they perform those? Um, do they have any cultural beliefs and customs that we need to be tending to as well? So remember, that has to be a part of their care plan as well. Assess the patient's gait to determine if they're stable, if they have aids like a cane or walker, are they functioning properly? Does your patient know how to use those items properly as well? Okay, so applying an elasticized bandage, so that be like an ace wrap or something like that. Um, so remember, when you're applying those things, you want to go from distal to proximal. Remember, we said, so that's from the bottom up, going towards the heart, whether it's the arm or the leg. We're going distal to proximal because we want to promote circulation back to the heart when we're wrapping. You want to overlap the turns equally throughout, so applying pressure evenly throughout the wrapping along the extremity or whatever it is you're wrapping. Make sure it's smooth without wrinkles, because you don't want those wrinkles putting pressure on the skin there, potentially causing any skin breakdown, and secure the end of it with whatever. Some ace wraps have Velcro, some have the clips or whatnot. If you're using um, tape or some type of bandage or something like that, making sure you're doing your neural checks, making sure you're wrapping it, rewrapping it at least twice a day, um, to check for, circulation, skin integrity, and things like that as well. Okay, so a person might use a sling um, to hold the extremity in an elevated position. And so you do that to try to maybe avoid edema in the hand or something like that, avoid pain and discomfort or fatigue of that particular area. I have posted a video on Blackboard. Make sure you take a look at that on how to um, use the sling. So a mechanical lift, that would be like a Hoyer lift or something like that, and that's used to transfer a patient from, maybe you transferring a patient from bed to chair or chair to bed or to a tub or a whirlpool bath or something like that. And so you want to make sure you always have two people for safety when you're using those mechanical lifts, and never leave that patient unattended. You want to be careful when you're transferring them. I've seen time and time again where people are careless and they bump the client's leg or something and get a skin tear or whatever. So you always want to make sure you use two people for safety and making sure you don't injure the patient. Okay, so I have posted videos on Blackboard for you to see how to use walkers, crutches, and canes appropriately, so that you can be able to properly teach your patients how to use these devices. When you have patients, that are using these devices, you want to make sure that they're adjusted properly to fit your patient's height, um, as well as making sure the device is within reach for the patient. If you have a patient, for example, if you have a patient that uses a walker, you don't want the walker across the room by the door and not by their bed. So when they go to get up, they don't have access to that ambulatory aid to assist them. Make sure you keep the floors clear from clutter as well as well lit um, for your patients that are using these devices. So make sure you do take a look at the videos on Blackboard to see how to properly use these aids. All right, question 4. When discharging a patient on crutches, it is imperative that he know there should be how much space between the top of the crutch and the axilla when his hands are gripping the crutches. So the answer to this is 2 finger breaths. You want to make sure there's at least 2 finger breaths of space between the top of the crutch and the axilla, because the person shouldn't be pressing down in their axilla when they're using the crutches. And then question 5, Tim's patient needs a lift to help him get into hydrotherapy. When using a lift, all of the following are true except the answer is 1. One person can safely move a weak patient this way. Remember, we said 2 people are required to lift safely.